And of course, we talked about allergies already, right? The more immunoglobulin, the more our immune system is hyper responding, hyper reacting, there's a chance that we're going to develop more food allergies. We're going to increase gut permeability. That's going to impact leaky gut. That's going to impact nutrient absorption. And we need all these nutrients to run our different metabolic pathways in the body. So hope that helps out of the gate, guys. I'm just trying to kind of give you a decent idea of what to look at and talk about some of the big connections here. And hopefully it makes a little more sense to you guys. Again, when I look at Candida, usually Candida doesn't just happen by itself. Usually you're seeing Candida with other types of bacteria, whether it's just your general despotic overgrowth that you see within SIBO, whether that's citrobacter, klebsiella, proteus, or morganella. These are different bacteria that you'll find on a SIBO kind of test. Now, on the stool, you'll see the actual bacteria. On a SIBO breath test, that's a lactulose breath test, you'll see the different methane or hydrogen gases that go elevated. It will never tell you the type of bacteria, but usually you're going to see the bacteria I just mentioned, the Pseudomonas, the Klebsiella, the Citrobacter, the Morganella, and a breath test can be another helpful way to look at it because these gases like methane or hydrogen, they can impact motility, cause more constipation, cause more diarrhea. They can impact absorption as well, especially if you have lots of gas and bloating. You could have diarrhea, and that could push food through the intestinal tract faster, and that may make it harder to absorb a lot of your nutrients, guys. And so I like doing different testing. I'm going to do a good high comprehensive PCR stool test. We're going to look at the gut, look at bacteria, parasites. We're going to look at malabsorption, elastase. We're going to look at enzymes. Again, stool tests tend to not be the best way to look at yeast or candida. If it's there, even at low levels in a stool test, it's definitely a problem. Good to keep an eye on that. I'll also run an organic acid test and look at, 3-oxyglutaric, or we'll look at tartaric acid, or we'll look at D-arabinose. These are good candida metabolites that we'll see in the urine of a good organic acid test. So that's super helpful to see that because that'll give me another window into the fact that, hey, we may have candida. I'll look at clinical signs and symptoms. Do we have fungal toenails or fungal fingernails, that kind of yellowy type of keratin debris on the nail? Do we have any seborrheic dermatitis in the hair, that kind of like cradle cap? Again, you can Google image these things. It'll be a lot better to do that. Do we have any tinea versicolor, any fungal rashes on the skin? These are all good telltale signs that we may have a fungal issue. Dandruff. Dandruff also tends to be more fungal in origin as well. So it's good to know if these things are there. You probably have some other kind of fungal issue going on. And there's different herbs that we may use to knock these things down. We may use undesolenic acid. We may use emulsified oil of oregano, silver, biofilm busters. We may use oil of oregano. We may use golden seal, higher dose berberines. These are all, monolaurin. These are all good things we may use to kind of knock down some of the candida. Of course, utilizing diet changes, cutting out a lot of the processed food, the acellular carbohydrate that feeds these bugs in the beginning, being very careful of antibiotics. And if we ever have to do an antibiotic, we're going to be really careful and use good probiotics after the fact. We're going to use saccharomyces boulardii, which does tend to crowd out candida and yeast. It does help bump up IgA levels as well, and really does help the immune system